Hello, my name is Nahida, and today I will present to you a series of information regarding artificial joints and its position in society today. First, I will begin by introducing artificial joints to you and what the process consists of. I will then move on to speaking about the pros and cons using cases to back up my information. I will also be talking about the recent findings through studies which have led for a better alternative to artificial joints. What is an artificial joint? An artificial joint is when a damaged joint has been replaced with an artificial one. Artificial joints are mainly as hip or knee replacements. A doctor who specializes in this surgery is called an orthopedic. Generally, the surgery takes place due to pain of the joint and the inability to live a normal life. Who should have this surgery, you ask? Well, the surgery is most commonly taken place on elderly people who have been diagnosed with rheumatoid arthritis, which causes swelling and pain of joints, osteonecrosis, which causes the joints to die, or a bone tumor that has broken down the hip joint. Moreover, if an elderly person has had a big fall, or an athlete for example, then they will be prone to having this surgery. What happens after the surgery? Well, post-surgery, the patient will have to meet with a physiotherapist in order to be taught how to walk with their new knee or hip, as well as bending over and teaching the patient simple exercises which will help the patient become better. Patients will be discharged from hospital 3 to 5 days post-op and will be able to completely recover within 3 to 6 months of the surgery, depending on the patient's health and ability to practice exercises efficiently. So, the success rate. Over the years, there has been thousands of these surgeries conducted. The success of this alternative has been truly tested. This success can go both ways. Many who have undergone the surgery have been able to continue living a normal life and have had no further issues. Whereas on the other side of the spectrum of this surgery, patients have been caused more pain. According to statistics from the Australian Institute of Health and Welfare, there have been a 40% increase of the amount of hip surgeries that have taken place between 2001 and 2008. Furthermore, in 2009, there was an increase of 3.4% more than in 2008. It is predicted that by the end of 2050, there will be 7 million Australians affected by arthritis and will need a hip or knee replacement. Television comedian Amanda Keller quotes, "Just a week after the operation, I could walk with the kids down to the beach. I haven't been able to do that for months. It's been incredible." So, through this, we can see the importance of artificial joints in order to help the people of the community to live efficient lives where they can conduct their day-to-day activities as per usual. So, the failures, you ask. Despite artificial joints being quite beneficial to society, many have come to the realization that although it is a great temporary measure, people must think of the long-term issue. According to the Sydney Morning Herald, more than 450,000 artificial hips have been implanted into Australians since 1999, thousands of which have claimed that these replacements have poisoned them. Dee Harvey, who had undergone a hip replacement in 2003, was told by doctors that it was expected to last 15 to 20 years. She quoted, "However, it only lasted 7. After many symptoms such as coughing and swelling, Haver was diagnosed with metal leaching with MOM hips. According to a trio of Queensland medical specialists, they quoted, this meant that the cobalt and chromium in metal hips released a variety of metal ions into local tissue and into the general circulation." Another hip replacement like Dee, Janice Boyce, said to the Sydney Morning Herald that her hip replacement caused her nothing but pain for 3 years. Can you imagine that? Other than that, the fact that it is affecting Australians in a bad way, it is also costly. So, according to statistics, with more than 800,000 Australians having a joint replacement, there are 90,000 devices inserted costing around $1 billion. That's a whole lot of money. So, as we can see from the following cases, there are two very diverse opinions on artificial joints and its ability to impact society, as well as the costly measures that come with. For these reasons, there has been a lot of studies being put to test in order to find a better alternative for society. The outbreak, fat-derived stem cell therapy. the newest solution to joint pains. It is aimed to allow the regeneration of joint and tendons by collecting stem cells from the patient's fat, specifically the adipose tissue. The cells are then injected into the damaged area in order to replace what has been lost. This has the ability to reduce inflammation and increase the growth of healthy tissue. The stem cell therapy is predicted to push back this surgery for 10 to 20 years. Can you imagine that? According to Diana Robinson, which is a doctor at the Sydney Sports Specialist, she says that the proteins involved in the growth of cartilage are producing new tissue. After this, the injection should take effect in up to 10 days. So now what? Despite this new procedure, doctors will continue to operate on patients who have tried all their options, including stem cell therapy. The new discovery has opened doors for many. If all measures do not work, then the last resort will be to separate and replace the hip or knee with an artificial one. Thank you for listening, and I hope it's been beneficial.